People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784 456 1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Good evening to you once again. This is Your Health Matters, and this is Dr. Gerald Thompson, your host. Wednesday night, 8 p.m. Remember, 457-9997, WhatsApp or straight. And I really should be giving out an email because I've got a special email. Just can't remember the password for it. But essentially, before giving it, I'll give it out next week again, because I think a number of you have been sending a lot of messages to my general email address, asking questions. I would love to focus those questions on this particular email so I know that I could always go there and get them. But we accept emails, certainly, questions and so on. We could always slip in an answer before or after the main topic. But today, matter of fact, this month, October month is Breast Cancer Awareness Month. You know, Kamal, I don't know if you're aware of that. Yeah? If what? That's why some of them wearing the pink. Am I in pink? Is this considered pink?
No,
This is bright. This is bright pink. This is pink. It's my shade of pink. You know, it's a pink with a little hue of red to it. You know, but you see the pink stripes in there. See the pink stripes? You call them brown stripes or pink stripes? They're pink stripes. But you know, breast cancer. I wonder if persons have a firm idea. We know that the breasts are wrong here in the female and the male, and that there are a number of different types of breast cancer. Let me start off with that. Now, in general, I'll tell you, cancer has been ravaging a host of different organs, not just the breast, prostate, all these other things. And we have been noticing that a number of things help to induce cancer. Smoking, alcohol, weight, being obese, the type of diet that you have, the sun sign, although sunlight is going to mainly affect cancer, the skin. And certain infections can cause cancer. Air pollution, we know. And there are a host of other smaller things, but these are the big ones. And we also know that exercise, obesity, whether somebody breastfeeds or not, alcohol are also important with respect to breast cancer. Now, I was recently in England about a month ago. And one of the reasons why I was there, I was invited to an event, and I made some comments there at a very prestigious institution. I'm not going to get into that, but it was on breast cancer, the new innovations in breast cancer. And they talked about the new types of mammograms that are coming out. Not the mammogram where you have to stand up and put your breasts under it, which has issues of some false negative or false positive. It's where a person is lying down and their breast is actually in a little pocket, and they basically are able to get far, far better results, less false negatives, less false positives. And it's a type of CAT scan of the breast that they're actually taking instead. Now, we know that breast cancer, oh God, smoking is a big factor. But you know, one of the things that helps to reduce breast cancer and a number of other cancer is the type of diet that you eat. Do you know that eating, for sure, diets high in red meat, diets with reduced fiber, diets that do not have a lot of polyphenols. Now you may ask, what are polyphenols? Like in tomatoes, what gives tomatoes its red color are the polyphenols, you know? And what gives certain other foods, peppers and so, their own color and flavor and so is a polyphenol. So polyphenols help to protect our genes. And I will tell you something, our genes are constantly being bombarded. They've been bombarded with radiation from the sun, bombarded with all sorts of chemicals in the food, pesticides, and so all sorts of artificial coloring, all sorts of artificial sweeteners, and so. And these things, when they get in our body, they're bombarding the genes. And if you have lots of polyphenols in your foods, it will help to mop up some of these things. But if you don't, then when the cat's away, the mice will play. Now, I want to tell you, we also know that getting plant-based polyphenols is critical. Plant-based polyphenols. And our diets have changed so much. The chicken and chips with some ketchup, the red ketchup maybe come from tomatoes, but that's just not enough. Come on, I want to feel what I'm saying. You know? You're chicken and chips and ketchup man. You know? Yeah. But also, there's a whole ton of ultra-processed foods. What if anybody understand what's ultra-processed food? Ultra-processed foods is not the no. You know, if we heat up a breadfruit or we cook the breadfruit, that's still normal unprocessed food. Ultra-processed food is where they take some protein from this and they take some artificial sugar from that and they take something from that and they put it together, give it some coloring, give it some artificial flavoring that seems as if it's a little bit like pineapple or seems as if it's a little bit like this, and package it together to make it look like a sausage or luncheon meat or make it look like a breakfast cereal or something like that. But it's all ultra processed. When you break it down, a lot of the natural ingredients have come from all sorts of different places, put together like a jigsaw puzzle to make it fit. And they've tested it with hundreds of people. Does this taste good? Does that taste good? They add a little bit more sugar. They add a little bit more protein. They add a little bit more coloring. Does it look good? Does it taste good? That's how we get a lot of ultra-processed food. And it's been proven now that in the West, in America, and probably very possibly that 70% of the calories that people are taking in are coming from ultra-processed food. A 10% increase, every 10% increase in the amount of ultra-processed food that you eat, it increased the risk of cancer. And it increased the risk of the cancer mortality, of dying from cancer. And so, reducing the amount of ultra-processed food is critical. But I was making the case that these sort of ultra-processed food could affect all kind of different cancers. And we're talking about breast cancer today because this is Breast Cancer Month, Breast Cancer Awareness Month. And I was making the case that while there are many different types of cancer, that the cancer of the breast, the type is important, but where it is located, how it spreads, and whether we've picked up the cancer early are far more important. Another factor is where you live, because in certain parts of the world, even if your cancer is picked up early or late, they have all the treatments and protocols to deal with your cancer. But in some parts of the world, yes, if it's picked up early, that's great. But if it's picked up late, you don't have all the chemotherapy measures, you don't have the radiation therapy, you don't have the hormonal treatments, you don't have the new modern treatments that have been tried and tested and shown to work. And that's why early detection is so critical in a place like St. Vincent and the Grenadines. I think the chief medical officer last year pointed out that St. Vincent is a place where they have about 25 to 30 deaths from breast cancer each year. 25 to 30 deaths from, and that's considered high for our population. Now, let me tell you, China and America have thousands of people. As a matter of fact, do you know, last year, 650,000 people died from breast cancer. 650,000 people died from breast cancer. That is a lot of people, you know? 650,000 people. And 50% of them had no specific risk. And it wasn't that they were smoking, it wasn't that they were overweight, it wasn't that thing. And what it tells us is that there may also be a very strong genetic component with breast cancer. And that's what I want to get into. Now, when we talk about breast cancer and how the cancer behaves, it's important to know the type of breast cancer. And there are several types. Now, the first type of breast cancer you need to know about is what we call invasive ductal carcinoma. Why am I saying that? Well, I brought a little diagram for you. I'm going to show you something for those of you who could see online. This looks strange. I've got a little bottle and I've got a little tube. Inside your breast, the female breast, there are, let's say this is the right breast, there are thousands of these little lobules, they call it. This bottle is like a lobule. And this is what will produce milk if that person gets pregnant. And then this tube, the milk will run down this duct to the nipple. And this is where the nipple would be. So in your breast, you have these glands, these lobules that produce milk or will produce milk. Once a woman's pregnant and have a baby and so forth, they can produce some milk at other times and so. But the important thing is there's a tube, a duct that runs down from the gland. I want you to think of not just one of these lobules, but I want you to think thousands of them in the right breast and thousands of them in the left breast. Well, I want you to understand that breast cancer, one type of breast cancer is called ductal carcinoma. Carcinoma means a particular type of cancer. And this type of cancer is called invasive ductal carcinoma, which occurs in the breast. And this is the most common type of cancer, accounting for 80% of breast cancer, of invasive breast cancer. Invasive breast cancer. Now, there's another one called invasive lobular carcinoma, ILC, invasive lobular. That's where the cancer is occurring in the gland itself, in the gland, not the duct, but in the gland. And guess what? This is 10% of invasive cancer in the breast. Is that 10%, 80%? Now, I want to also mention that that's the site, but there's some other factors. Do you know that these cancer cells, whether they occur in the duct or in the lobule, that they have some markers on them, you know? They have some identifying markers. And if some of these markers are absent, we call these markers, if they're absent, triple negative breast cancer. Triple negative breast cancer, because the cancer does not have receptors for estrogen. You heard of estrogen as being one of the reproductive hormones. They do not have receptors for progesterone, and they do not have receptors for a special type of protein called HER2, HER2 number 2. HER number 2. Now, you ask, what doc talking about all this technical stuff? These are markers on the cancer. And if they are negative, then I want to tell you that that is not good. That ain't good at all. And about 12% of invasive cancers are what we call triple negative. Negative for estrogen, negative for progesterone, negative for HER2, HER2. But then there's some other type of breast cancer that are triple positive. In other words, these cancers, they have receptors for estrogen, for progesterone, and for HER number 2 protein. And that accounts for about 10%. Now, there are some breast cancers that are what we call inflammatory breast cancers. Inflammation. The breast is just inflamed. You know, you could have an inflamed foot or an inflamed knee or an inflamed ankle. Inflammation where it's red and so forth. Well, I want you to consider where inflammatory breast cancer is rare. It only occurs in 1% of the cases, but we have to know. We have to know to be able to apply the proper treatment. And then there's another type of breast cancer. It's called micrometastases, in where the cancer starts to develop in little clumps. Sometimes in the lymph node, you know, of your neck, underneath your arm or so. I'll tell you the truth. We tend to teach women and men how to examine their breasts. I'm not going to do that today. But typically, we use these parts of our hands and we try and we go along the outside and move in to the nipple. And at the same time, we want to feel up under the armpit. And we would do the other side. And there's a way in which a woman would hold up her arm in front of a mirror and do this. Or if a doctor does it, or a nurse practitioner or something, all these things help. But knowing your breasts is important. At certain times in a month, the breast can become lumpy and you can feel funny things there. If you ever get struck on the thing, a bump, like a cricket ball hit you, or sadly say if you get into a fight with somebody and you get struck on your breast, these things could cause a little blood clot and so forth, and you could feel something. But typically, women who have breasts that are lumpy at some time in their cycle, that lumpiness can go away. And what you want to do with breast examination is to see if the breast, if the changes are becoming permanent. So if you feel a few little lumps and they're there for more than 3 days, if they're there for more than 5 days, go see a doctor. If they are there for 3 days and they go away, check them the next month at the same time. See if they come back and so forth. Might still go and see a doctor too. But lumps in the breast occur for all sorts of reasons. And it's good to know the terrain. It's not too good, like you're driving a car, you know where a pothole was yesterday because your tire went in it. You got to know where those things are. And it's good to be able to feel under your arm, because the site of most breast cancer is in the upper outer part of your breast. The upper outer part of each breast. And it could be right or left. And you also want to make sure that you examine the lymph nodes under your armpit. Feel them. If they're like rice grains, or so, if they're like peas, or so, if they start getting like marble size, you don't want that. You know? You don't want that. Now, I want to say that for women who have had breast cancer before, there can be recurrent breast cancer that has come back. Breast cancer can recur at the same site that it came before, because enough of the breast was not removed, or it could come from nearby lymph nodes, or there are other little things that could happen. But what I want to now add is that that's finding cancer, invasive cancer. There's another term you need to know about, and it's called carcinoma in situ. Why am I mentioning that? Kamal, you can answer what I mean? It means that the cancer hasn't started to spread or become invasive yet. It is just there inside that piece of breast tissue, but it hasn't started to spread yet. So the point I'm making is that if you have a lump in your breast and a doctor examines it, you have a mammogram and it shows there's something there, they may well go and do what's called a biopsy. They may want to take a piece of tissue from that area and send it to the pathologist, the doctor in the hospital who looks at these things on a microscope. And what he will look at is, he will look to see if cancer is beginning to form. And if cancer is beginning to form, it's called carcinoma in situ. But he's also going to look to see if cancer has already formed and has started to spread. You want a situation where there's no cancer at all. None. But if something is found, then you got to hope it is early stages. The carcinoma in situ. The carcinoma inside, the cancer in situ, still inside the cell. Where we don't want is invasive cancer, where invasive means the cancer has spread outside of the cells to other parts of the breast, to various places. Now, I'll tell you something funny. there are some very unusual signs of breast cancer. Breast cancer is a very unusual disease. And often, important questions can be asked. Women could ask, can I have breast cancer without a lump? The answer is breast cancer is not always accompanied by a lump because one, it could be so small, it could be in the early stages where it's a carcinoma in situ, it hasn't started to become invasive yet. Or it's like an inflammatory cancer. It's in the inflammation type, which is rare, so it isn't going to form a lump. But still, a mammogram and a biopsy could pick it up. Now, how long can breast cancer be there without knowing it's there? How much time do you have? Well, you can have breast cancer for years without noticing any changes in your breast. Years, I'm taking you. But the important thing to know is that there's some cancers that are very aggressive. Very aggressive. They haven't been there for years. They've picked up very quickly and they're aggressive and they move very, very quickly. Now, what are the earliest signs of breast cancer? Let me go through that. Having a new lump in the breast or an armpit that hasn't gone away in 3 days. You understand? Having a new lump. In other words, you examine every month for the last year, for the last 2-3 years, and you ain't just a new lump. Now, what about thickening and swelling of different parts of the breast? In other words, the skin, it just seems thickened. The breast was very supple, but now it seems thickened or swollen, or irritation or dimpling of the skin. You see how I have my beauty mark, my dimple here? Come on, you don't have a dimple. You know what I mean? I don't have one either. But if you have dimpling of the skin in the breast, that's suspicious. How about redness or flaky skin in the area of the nipple? Or worse, if you see the nipple start to go in, or the nipple start to change in direction and dip down. If your nipple have been sticking out, or if they've been going to the side, but all of a sudden they start to change direction, like the nipple gets pulled in, you have an innie, it starts to go in, or it starts to change direction, that's not good. Or if you start having pain around the nipple area. Now, breast cancer doesn't normally have pain to it. If you have an abscess in the breast or a cyst or something like that, that could give you pain. But breast cancer won't give it. But if sometimes pain around the nipple can give, and there's some silent things, things that just take place so silently. If you have a piece of the skin over the breast, and the surface of your skin starts looking like an orange peel. You know how orange looks? With these small, tiny little dents? Come on, you ever seen that? Yeah? Yes. And if you have any loss of feeling, you touch it, there's a loss of feeling. Or if you have a discharge from your nipple, all these things are not good. Yes, somebody was asking about a discharge, and I just was touching on that. One of the silent things to look for is if there's a discharge. Now, if there's a discharge, and on top of that, if the discharge is bloody. So when you're examining your breast, you should also squeeze your nipple and see if there is any discharge. Sometimes there can be a little discharge, maybe normal, but it's a silent sign. But if that discharge is bloody, go see the doctor. Thank you very much for that person pointing that out. That's very important. Now, as the next one, yes, and around so there's nipple and there's a dark ring around the nipple of the breast. And there can be all these kind of very subtle changes. And it's very important. First of all, if you have irritation or dimpling in that area, or if there's redness or flakiness in the areola area around the nipple, all these things are very important. You should be looking out for. Now, so we look at this. Now, if you have a lump in your breast and you have a nipple discharge that is bloody, whether it's bloody or clear or a little bit of bloody from time to time, or your nipple gets turned inwards, inversion, or flattening of the nipple. The other nipple is fine, it's sticking out, but there's inversion in one nipple or flattening of it. I want you to take note of this. In addition, if there are changes to the skin texture, if there are changes in the air, in the size and shape of the breast, if one breast seems to be bigger or an unusual or changes in the shape compared to the other breast, if there's redness or swelling, these are things that we consider to be stage 1 of breast cancer sign. After the mammogram, after a biopsy, we may be able to show that cancer is actually there. And the doctor will plan what kind of surgery is going to be required. That's going to depend on the size of that lump, whether or not the lymph nodes under the armpit are affected. If they're not affected, that's good. But normally, surgery will need to take place. And where the lump is, you need at least a 1 centimeter margin. Now, you heard me saying about triple negative. If they do some special tests on the cancer and find that it is triple negative and all these kind of things, then that's not a good sign. And guess what? They should remove the entire breast. But in addition, the doctor will determine whether you need to get chemotherapy before the breast is removed, so as to shrink the lump a little bit, and chemotherapy after we remove the breast to make sure it has killed out all the stress cells that might still have stuck around, trying to hide, You all give chemotherapy after, and sometimes they also give radiation. All those things are going to depend on a number of factors. Radiation not available in St. Vincent. The chemotherapy is, and it is really important to have that. Now we're going to take a little break and come back, and we're going to dig down a little further into this.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Let me say, long ago, there was a special type of surgery called a Halsted surgery, in which they removed the whole breast. They removed even certain muscles. They removed the lymph nodes under the armpit. They removed almost everything. And we've since found out that it was a radical type of process that things afterwards, that some women had difficulty adjusting to those type of things. You understand? The mental process that takes place, it left all sorts of post-traumatic stress and a considerable amount of depression. Some women, actually, it was fine. They got rid of the cancer and they just really wanted to get rid of it. But some women, because sometimes the way it affects the relationship they're in or the way they feel about themselves, it certainly has some impact. And so there's been a number of other measures that have been used that are not as radical as that, but it involves women reading a lot more about it, learning, and the doctors having the tools to be able to make sure that they've gotten all the cancer. Because one of the things you don't want is, even after you've gone through some surgery, is for the cancer to come back, what they call recurrent breast cancer. And this could come back at the same place, at the margins of where the surgery was done, because a few cancer cells were hiding. They were hiding and they weren't removed. Or they could have already traveled into lymph nodes and gone pretty far. Or guess what? They could occur in far places of the body, the brain, the lungs, other parts of the body, because they had long traveled through the bloodstream. Now, male breast cancer is considered rare, but it happens. I've seen a number of cases. And it says it's fewer than 1% of all the breast cancer, but that's still a lot. 1 in every 100 persons being a man is still a lot. And they don't do well. Men don't come in early. For that matter, I know I've had a very close friend, and she had breast cancer. Educated woman, but she hid the breast cancer for months and months and months until the cancer started to burst out and create a sore on the skin and start to leak blood. And she was hiding this all the time because she was so scared. She'd probably read a little bit and didn't know what to do, and so decided just that to probably keep hope, some kind of hope alive, And unfortunately, it wasn't the case. There's no other question there. Huh? There's another question there. Okay, let me take this other question. What does this question say?
No. It's not actually a question. They're saying that we have prosthetic breasts to make it look like you actually have a breast.
Oh, yes. In terms of, there's been a lot of work done. They used to have silicone that they would insert and have reconstruction surgery. And sometimes the silicone would leak and would cause problems and cause inflammation. But they now have some very interesting methods that are suitable and can be applauded in terms of what they're able to do. Reconstructive surgery is a big field. But I wanted to point out that breast cancer, if it is detected early, can be something that we can tackle, that you as a patient can tackle. A stitch in time can save 9. And if you are in the habit of doing self-breast examination, that will help. Small. Of greater importance is having your mammogram. Women who are over the age of 50, you should be having a mammogram because breast cancer increases with age. I'll tell you this, and let me say this very carefully. Women who have not had children, like a nun, or women who've not gone through pregnancy, are at a higher risk of breast cancer than women who've had multiple children. But it doesn't mean that women with multiple children are not at risk because of these genetic factors. If your mother or your sister came down with breast cancer, you may have the genetics to develop breast cancer too. Irrespective of how many children you have, irrespective of what's going on in your diet, eating polyphenols and so cutting down on the ultra-processed food will help. But the important thing is that you are able to do your annual mammogram. Remember, I say it does take sometimes years for these cancers to develop. So even if the mammogram doesn't pick it up 1 year, the next year, if they pick it, I'm sure they'll pick it up again if it's slightly bigger. And what will happen is that it will be picked up at the stage that it is carcinoma in situ. That is the early stages of cancer. I hate to use that term, carcinoma in situ. But that's the term the doctor will tell you if they are able to detect it and do a biopsy. And so they say, oh, it is just a carcinoma in situ. But if you've left it, if you have not been taking care of yourself and you ain't going to no doctor because the doctor is too expensive, you don't like doctors, your last doctor, you didn't like the way they talk to you. They talk to you hard, telling you to stop smoking, or telling you to lose weight. Well, that doctor has weight too. That doctor, imagine that doctor has weight and telling me to lose weight. She should lose weight first before come and tell me to lose weight. Yeah, that probably should be the case. But that doctor should still tell you to lose weight. But the point is that by not having a doctor, by not going back to a doctor, or if you are in the United States or Canada or England and you're an immigrant and your papers ain't right, therefore you may not want to go to anybody. But the point is that you need to get your annual checkup, especially if you have a mother, a sister who also died of breast cancer. That's serious. And you should be doing mammograms way, way, way before the age of 50. We're doing it like at the age of 40. The exact time and so may actually be even earlier than that. But for sure, you should be doing self-breast examination and mammograms early. And as a result, you are going. Now, you may ask, well, will the mammogram hurt me? Well, if you have a technician and the way the mammogram is set up, some people, it can squeeze the breast a little bit, but it's not a big deal. These technicians are trained so well that they are not going to see problems. Now, men, not only should you examine yourself, but oh my God, you're the best person to examine your girlfriend's breast. You're the best person to examine your wife's breast. You should know your wife's breast and be able to, darling, I felt your breast, last week and so forth. And it seems like a little lump over here and so forth. Don't you think so? You know what I mean? Your girl will say, oh no, that comes up every month. But okay, all right. But why you go get a mammogram now? You know what I mean? I'll pay for it. They're cheap. They're down at the hospital, only $30 for a mammogram. $30 for a mammogram. You know what I mean? So go down and get one. No, I stand corrected on $30. I don't know if the price has gone up. But irrespective, as your man, I will prefer it. I want to make sure, okay, you prefer it, darling. You know what I mean? Men, I want you to encourage your women to go and get that mammogram. Sometimes, I agree, the mammogram could come up with a false positive to say something is there and it ain't really there. But it's better to be safe than sorry, you know? Sometimes, far less frequent, the mammogram may miss something, especially if it's small. But the thing is that the next year, it should be able to be picked up again because the breast cancers normally grow slowly. There's some of these breast cancers that do grow rapid and aggressive, but you got to hope that that isn't one of you. But mammograms are so helpful in picking up the radiation for mammogram, no problem at all, right? And whilst the technicians are good, and so some women with very small breasts, it's difficult to pick up things of breast cancer. It's just like the male, you know, sometimes difficult to pick this up. But the important thing then is to see if there's any changes. I want to emphasize cutting out all this stuff, the smoking, losing weight, eating properly, getting polyphenols in your diet. All these things are crucial, critical, important, and you really should be doing it, you know? And the person was saying, the person with the comment saying, no, it's not just a little discomfort for a while. I wonder if that is in relation to the breast, the mammogram. You know, the technicians can do excellent mammograms and some new mammograms that are coming out, but there can be a little bit of discomfort. Some women, depending on the size of their breasts and trying to get the whole breast inside there and so forth, and the X-ray to come down close to the breast so you can do a proper breast. You don't want to just take you stand up and somebody take a picture of you. Tell somebody, can you take a picture of me, right? And when you look at the picture's out of focus. The picture is twisted. They catch you with your eyes closed, you know? And you gotta ask someone else to take a picture again. So the thing is that the mammogram has to be done well, properly, so that it could pick things up. You want the mammogram to be in focus. You want them to take their time and do it such that they take a nice picture of your breast. After that, the radiologist will be able to look at it and see all the details. You don't want no out of focus picture of your breast and so. You don't want no out of focus mammogram. Important. What I'm trying to emphasize today, though, is that cancer of the breast is mainly in the ducts coming from the milk glands. The nipple is right here, and all these ducts lead to the nipple. And cancer could occur anywhere along here. That's why cancers could also occur right there at the nipple. You know? When they occur right there at the nipple, and the cancer is growing, guess what it does? It pulls the nipple in, or twists the nipple off to one side, or causes the ring around the nipple, the areola, to dimple, or to pucker, to get pulled in like a button being pulled in, you know? And you don't want that. The nipple could get flattened, you know? There isn't usually a lot of pain, but it could be redness and inflammation, and the skin could start looking hard. It could start looking like an orange or grapefruit skin. You know, after you peel an orange, you see how it does look with these little dots on it? We call it the orange peel effect. You didn't want that. You didn't want the cancer to reach that stage, you know? By doing mammogram, cell breast exam, you could pick up the cancer long before it has started to cause all them changes in the nipple, in the skin, before it start to make your breast look out of shape and twisted, one bigger than the other. If one breast is bigger than the other, it shows that, boy, there's a lot of tissue there that shouldn't be there. But boy, the genetic of cancer, there's a lot of cancer that runs in family. And these triple negative type cancers, there's a whole set of genes. And we now know that the genes that help to form cancer, what is inducing them is the stuff in your diet. What's aggravating those genes are alcohol, smoking, the chemicals in smoke, the stuff in ultra-processed food, the artificial flavoring, the artificial coloring. These things just really cause a whole set of problems. And certainly obesity, when you're overweight, and so the high fat is gonna help push towards things like cancer. It's time to really deal with this. I mean, I've been making the case that in Breast Cancer Awareness Month, we have to do quite a lot of work to make sure that cancer of the breast is not such a feature. Now, cancer of the breast for many years was the most common cancer out. But because we've been making women more aware, we've been picking up a lot more women with carcinoma in situ, the early stages, and dealing with that, as opposed to finding a woman with invasive cancer, whether it's in the duct, whether it's in the breast gland, whether it's inflammation. You really want to make sure that a stitch in time saves 9. And I couldn't be emphasizing this more. Now, men, you need to also check too. And today in St. Vincent, we do have the chemotherapy necessary. Chemotherapy is not so much used to treat stage 1 breast cancer, but when it starts coming to stage 3, stage 4, when it started to spread, oh boy, and all these things are important. There are lots of new therapies, lots of new things coming out with breast cancer. I saw and heard a lot of these in England. I'm not going to get into that detail, but the important thing to remember is breast cancer is the leading killer of women in St. Vincent and the Grenadines. Yes, prostate cancer has now overtaken breast cancer as the leading cancer, but that occurs in men. And women, breast cancer can occur in women, and 1% of cases occur in men. So it's going to be important, very important, that everybody really looks. Now, we've had a couple of, is there another question there? Huh? Oh, the person is thanking me, yes. Yes, no, it's just like a little discomfort. Yes, the person is talking about the mammogram and saying it's for the while. Yes.
Oh, the reference in mammogram, the discomfort says no pain, but just a little discomfort. That you call it.
Yes. Yes. The person who was commenting and been commenting on this says, yes, with the breast, the mammogram is not painful, just a little discomfort. That's understandable, and you have to hold your breath while the picture is being taken. Thank you, gentlemen, right? MSG. MSG is a form of, yes, well, interesting stuff. But I am, in signing off, I really recognize that I applaud the fact that there's a breast cancer awareness month. I know there's a lot of activities that tend to take place. And if you have a sister, a mother who may have died of breast cancer or had breast cancer, you need to have breast cancer not so much on your mind, but on the tips of your toes and tips of your fingers. You need to take some action, right? And deal with this. Have a regular doctor. Have a team of people who you are going to be able to see, to consult with. For those persons who have had breast cancer before, never think that it is over. If you're able to overcome the anxiety and depression and the other issues that come with having had surgery, chemotherapy, radiation therapy, all those things, then that's really good. But in addition to a lot of the psychological effects, the fear of recurrence, or if for any reason it does come back, it does come back at the same site on the other breast. If it comes back in the lymph glands at some other part of the body, or it comes as some sort of tumor in the brain or the lungs because of spread, then, I want to wish you the very best. There's still an opportunity to beat the breast cancer. So with that, ladies and gentlemen, I want to sign off and bid you a very, very pleasant good evening and really wonderful Breast Cancer Awareness Month. This is Dr. Gerald Thompson signing off. All the very best to you.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m.